Hi there. How are you doing? How are you feeling today? Oh, good. Well, I've been thinking that tonight it would be cool to have a cranial nerve exam, but now we're experimenting and we are doing the kind of cranial nerve exams which are super relaxing. And you can even close your eyes if you wish. How does it sound? Well, I hope that you're gonna enjoy it a lot. It's very, very relaxing. You might even fall asleep afterwards. Well, most probably you will. At least most of the patients fall asleep really, really effortlessly right after this exam. Sometimes even in the process. Well, anyway, what I was saying, let's first confirm your personal data really, really quickly, okay? And then we'll do all the rest, right? Okay, so your first name is, and your last name. Okay, your home address would be. And your email address. Yeah, we absolutely need that. We're not gonna spam in the messages, I promise. Right. Well, we just need to, be able to contact you and maybe to send you the summary of your test afterwards. It's especially convenient if you also get some blood tests, if you get your blood drawn and stuff, so then the results from the lab can be sent right to your email address and you don't really need to come to the doctor's office to get them. Okay, well, so could you spell that for me, please? Perfect. Okay, good. That's a pretty long one. Okay. I'm afraid to ask what your password is. Suppose it's has all 16 figures in it. Okay, well, anyway, no, just kidding. Now, your phone number finally. Okay, is it like 7 6 7 or 7 6? Sorry. Perfect. Alright, well, do you have any complaints? Yeah, you can already close your eyes while you're telling me that. Only if you want, you can keep them open all the way through if you want to. That's alright. So, you were saying that. Okay. Any kind of headaches, pain in your neck, ache like throughout your body, any kind of muscle sore when you're not supposed to have it. Okay, have you had any kind of fever lately? Any symptoms of cold or flu? Are you sure? That's kind of important, yeah, when it comes to any cranial nerve exam. Everything can influence the whole thing, so, like for example, if you don't have the sense of smell, I'd rather know if this is like the problem of the cranial nerves or just like some kind of cold you're still having or have had lately. So any nasal congestion, runny nose, sneezing, cough, allergy or rash around your body. Okay. What about your ears? How has your hearing been lately? Any kinds of clogged ears? You sure? Okay. Anything else you'd like to tell me? Please don't be afraid to share the information with me. I'm not Dr. Eclipse, just the medical student, but still, it's gonna be alright. You can 100% trust me. Okay, that's alright. No, you're totally safe with us. Okay, so once again, what were you saying? Okay, any other symptoms? Well, I suppose we can start with listening to your heart and your lungs. I'll put on this beautiful stethoscope and I will just ask you to follow my instructions very precisely, if that's possible, of course. I think so. Alright, well, just breathe in and breathe out for a moment. Let's do it together. Good? Good. Okay. Could you please breathe in for me? Breathe out. Good job. Now once again, breathe in. Good. Now once again, breathe in and out. Good. Turn around, please, and again, breathe in. Alright. Once again, breathe in. Good job. And now once again, breathe in. Okay. Let me listen to your heart. You can just breathe in your normal way. Alright. And now could you please cough for me? Go on. And now could you please breathe in and hold there, okay? And hold there. Breathe out. Yeah, you can exhale right away. Okay, good. Well, how are you feeling now? Right. Everything is just fine. Okay. So, both your lungs and your heart are functioning just the way they're supposed to. It's good news. Okay, I will put on my latex gloves. I'm gonna touch you really gently, I promise. Okay. Ready? Okay, good. Well, so what I'm gonna do is to touch your face really gently. I promise. No need to worry about anything, okay? That's gonna be just fine. Right, so what if I touch your face right here? Can you feel my both hands symmetrical on both sides of your head, of your face? What if I press here right above your eyebrows a little? That's still good. Now what about your neck? Let me just check your thyroid gland. Okay. Okay. Now once again. Right this way and out to this side. Alright. Could you please open your mouth and say ah for me? Good. Okay, and now could you please, okay, let me just have a look in your throat for a second. And now your nose. Just to the chin up a little bit. Perfect. Alrighty. Well, looks good enough to me. But still. Okay, you know what? Let me just have a closer look at your mouth and your throat. So I will ask you to stick out your tongue just a little bit, okay? I suppose shouldn't be too hard for you. Okay, I will just use the spatula. Right. Okay. Now could you please put your tongue to either side of your mouth? Wonderful. And now let's switch to the other side. Right. I just want to know if you can move it in your mouth. Just like that, exactly. Okay, perfect. Well, everything seems just fine. Now, there are some other things I'd like to test, if you don't mind, of course. Okay, so let's check your reflexes right away, okay? So I have this, I don't know if you can actually see, but I have this nice red percussion hammer for you. Okay, so let's have a look at your wrists first. Just relax, it's gonna be alright. Good. The other one. Good. Now I want to see your knees. To test the knee jerk reflex, I need you to put one leg over the other one. Right, just like that. And now I will. Okay. Yeah, keep them bended like this. Okay. Good. And now. Okay. Wonderful. So now your elbows. Good. Now the other one. You can keep your eyes closed if you wish. Okay, so now your feet. Good. Alright. Everything works just fine. Exactly the way it's supposed to. I told you not to worry, you see? Okay, well, anyway. Now, going back to your face, could you please puff your cheeks for me? Perfect. And I'll puff them and keep them in that position and don't let me close them, okay? Let me close them. Okay. Good. Now that's perfect. Now I want you to keep resisting me, okay? If that's possible, of course. Because I'm so irresistible. Oh my gosh, just kidding. Now, today I'm in my goofy mode. Okay, anyway. Sorry. So, please just hold still, alright? And what I want you to do is to clench your jaw and not let me open it, not let me pull your chin down, okay? So clench your jaws, please. Good, amazing. Now give me the widest smile possible. Perfect. Are you sure that this is the widest smile possible? You can do better. Okay, wonderful. Now, keep on looking at me. Okay, good. No, that's fine. I mean, if your eyes are closed, no need to look at me. That's totally fine. Okay, please tilt your head to one side like that. And try to to resist my hand. Yeah. Okay. Wonderful. Now the other side, please. And again, try to resist my hand. My hand. Yeah, just against your head. Okay, good. Good. Wonderful. So now I want you to frown at me. Raise your eyebrows. Okay. Shrug your shoulders. Wonderful. Okay. Now please try to reach the tip of your nose with your pointing finger. Straighten both of your arms and reach the tip of your nose. Yeah, you keep your eyes closed for that one. Thank you. And now with the other hand. Okay, give me a high five. Good. And now to the other one. Okay, perfect. Okay, now if your eyes are closed, which they are, I suppose. Well, anyway, doesn't really matter. So what I'm gonna do is to do some light tests, but they're supposed to work even if your eyes are closed. So I will only ask you to let me know whenever you can actually feel the light somewhere around your eyes. It's pretty strong, so you'll be able to feel it even if your eyes are closed. Okay, let's do it. So you can feel it actually. Okay, now just let me know. Keep them closed if you wish, and let me know when you can feel the light somewhere around your eyes. Okay. Good. Wonderful. Now, once again, let me know when you feel the light. Okay, amazing. Now I will ask you if you can feel any difference in the temperature of the light. Again, with your eyes closed, it might be a little bit harder to do, but still, you're supposed to be able to feel it. In case you don't, it's still fine. Don't worry about that. So, can you feel anything? Well, actually, yeah, this light, this other one, is supposed to feel a little bit warmer. But again, the difference is not that huge, so if you don't feel anything, it's still alright. Okay, so now I will ask you to try to concentrate and let me know if the light is warmer or colder. Once again, if you just miss it and make mistakes, it's still fine. Okay? No judging here. So was it warm or cold? What about now? Warm or cold? What about now? Okay, so it was definitely cold. God, what about now? So that was warmer. Okay, now what I'm gonna ask you to do is just to let me know which side the light comes from. Okay, if it's from the right, from the left, from the top, or from the bottom. Sounds quite easy. Okay. me know how many times the light goes here and there, okay? Let's say how many times it appears in your field of vision. Kinda. Again, even with your eyes closed, you will most probably feel it. If you don't, no big deal. Okay, like I said, it's an experimental cranial nerve exam, so you knew what you were signing for, so it's alright. Just in case these tests are not really like detailed enough, if they won't show enough information to us, then we will run a separate, really detailed eye exam, okay? With your eyes open, of course. Deal? Good. So count how many times the light appears and disappears in your field of vision. Can you count it now? How many? Oh, good. And now. Okay. And 4 times, wonderful. And what about now? 'Got it. Good. Well, you did really, really good. Okay, now I will ask you to do the same kind of thing. Just tell me now which side the light comes from and how many times it appears and disappears. So it's gonna combine the previous 2 tests, and it might be just a little bit more challenging, but not too much, I hope. Okay. 3 times from the bottom. Good. 4 times, and which side was that? Okay. What about now? So, how many times? Okay. is moving from the left to the right or from the right to the left, okay? Just the direction of the light. So what was that? Good. And now. Perfect. And now. Again, the same side. And what about now? Okay, great. Good job. Let me just type in some results, okay, the process. I don't want to forget something or just be inaccurate. Dr. Eclipse would kill me. Just kidding. What were you saying? Oh, that's alright. Your reaction to the light is pretty good, actually, so everything is like the way it should be. Absolutely. No, no need to worry, like I said. Okay, well, now let's check your hearing, right? Let's do it. So, let's start with the basic snap test. I'll make some snapping sound. You will let me know if you hear it, okay? Just nod to me when you hear snap sound. Good. Perfect. Okay. Wonderful. Alright, well, I guess that's, we're not gonna have troubles with that. So now, I will ask you to let me know how many snapping sounds you've heard. Sounds quite simple, which it actually is. So, ready? Let's do it. Good. Okay. Wonderful. Now, okay. Now I will ask you to let me know which side the snapping sounds are on. Okay? Either left or right. Okay. Good. Okay. Good. All right. Okay. Now let me know when the snapping sounds change their direction, okay? you can actually hear the second snap sound, okay? Just not to me. Good. Perfect. Okay. Wonderful. Now, let me know how many snaps you can hear and which side they're on. Okay? Did you manage to count them? No worries, that's alright, I promise. Good. Okay, wonderful. Now, let me just have a look at your ears with an otoscope. I guess we skipped that step. So it's alright. Alright. No, it's alright. Your ear canal is just fine. Absolutely. Okay, now let's do a tune and fork test, okay? Because a part of your hearing test is a part of your ear exam. So what I'm gonna do is to put this tune and fork right behind your ear. And you will let me know when the vibration along with the sound stop. Okay. Good. It stopped. Okay. Okay. Now I will put this tune and fork right on top of your head, somewhere in the middle. And we'll also let me know if you can actually feel the vibration and the sound symmetrically on both sides. And then also let me know when it stops. So, has it stopped? Wonderful. Good. Now, another thing I want you to do is to let me know if the rhythm is even or not. Okay. Good. You can keep your eyes closed. Okay. And now, listen again, please. You're sure? No, of course. You're right. Good. Now, once again. And what about now? was slower, but still similar. Okay, and now finally, alright, okay, you're doing awesome, seriously, just great. Okay, now let's check your sensitivity. I have a very beautiful brush. I'm not sure if you can see it or not, but still, you can open your eyes if you want to see it, but no need to do that. So, it has this pointed end of the handle, which is pretty sharp, and it has this very nice brush itself, which is very soft. Let's call it dull. So we're gonna run this sharp or dull test with you, and you will obviously let me know if it is sharp or dull, if you can actually feel it. Okay, before we check this sharp dull sensations, let's just check if you can actually feel the brush in your face and your skin. Okay, so just try to relax, and I will move it really gently on your face, but you'll be able to feel it if you're supposed to. Good. Are you ready? Could you actually feel it? What about now? And now? Okay, what about now? Okay, great. Now let me know how many brush strokes you felt on your face, okay? Good. Okay, and now 3 again. Okay, what about now? You know? 4. Okay. Now let's do the sharp or dull itself. It was dull. Good. Okay, and what about now? Okay. Good. And what about now? It was soft dull parts. Okay, and what about now? Good job. Now I will also run the same kind of test, but on your hands and your arms, okay, and other parts of your body. So please do let me know when you can actually feel the brush on your hand, okay? Good. You could feel it. Okay, wonderful. And what about now? Okay, so you can feel it on both hands, both arms. Now I will ask you to count the amount of strokes, brush strokes made, okay? Must be easy. Okay, good. Wonderful. Okay. Good. All right. Good. Good. Wonderful. Well, your sensations are pretty good as well. Everything is just alright, like I said. Good. Wonderful. So now let me just type in some results, okay? Before I forget. Do you feel tired? We're almost done, I promise. We only need to check your sense of smell and taste. So these are the only ones left. These tests are usually so much fun, so I'm sure you're gonna enjoy them to the fullest. Promise. Right. That's fine. Do you have any questions in the process? Like remember I told you not to hesitate. And if there is something you're doubting about or something you want to know, please don't hesitate to ask me, okay? I hope so. No, but I'm serious. That's good. Okay. So, your sense of taste, let's start with it. Open your mouth. Good. So, give it a try. There is no hurry, there is no rush, just it's alright. So what does it taste like? Peppermint. Right, yeah, okay, let's get this one. No, they look pretty much the same. But I promise it's gonna taste different. Open your mouth. Okay, good. So, what is it similar to? What does it taste like to you? Chocolate. That's right. And now once again, let's do one more. Do you like chocolate, by the way? What's your favorite kind of chocolate? Really? Good. Okay, open your mouth. Perfect. So, what's your favorite kind of chocolate you're saying? No, okay. And what about this third one? What does it taste like? Almond. Ooh, good. You're so specific and so precise. Amazing. You're right. All three. 100%. Good job. Wonderful. And our sense of smell, of course. Okay, well, we have different scents and testers that are gonna help us check your sense of smell and your olfactory nerve. nerve in particular. So let's start with this one, the transparent bottle. Okay, I hope you don't mind. So please give it a smell. Yeah. What do you think it smells like? Rose. Seriously? Okay, you're actually you're actually right. Exactly. Good job. Now what about this one? This black bottle. Okay. Please just take a smell. Once again. It is. So what do you think it is? Apricot. Good job. Right, sure. Apricot it is. I guess that will do for today. Yeah. So how did you like such format of the test? Good. Let me just work with the results a little bit more. I'll type them all in, okay? You can just relax in the meanwhile. Great. Oh, that's actually good. Perfect. Okay, well, so what can I say? You're doing really good, especially taking into account that you don't have any complaints. I think that I can actually just let you go. Sure, you can relax and just fall asleep. I'm gonna leave you for some time, and I can even bring you an extra blanket. Okay. Okay. Sure. Do you have any questions? Are you sure? Good. Alright, well, so close your eyes. Or